Welcome everybody to this Zoom conference with Professor Thomas Levy about olive leaf and hydroxytyrosol and with the benefit effect to produce vitamin C by the body. So thank you, Dr. Mahar Shaif, for your organization and making this Zoom conference possible. Thank you, Asma Misbahi, for translate and for all the work she. And thank you, Professor Thomas Levy, for this Zoom conference. So welcome and thank you very much.
Very good. Thank you, Dr. Bagley. I'm always happy to be here. As I think everybody can tell from the title of this presentation, is we've all known, I think at least in this group, of the importance of vitamin C in the body and of the fact that most people are genetically deficient, not 100%, in the ability to make vitamin C. It should be very exciting to realize, and I'll show you the evidence, that there are ways to overcome this genetic shortcoming and to allow people to start making vitamin C most of the time. Like all my other presentations, I have many different references, and all you see is a number. You take the number, go to this website, put the number in, and you'll go straight to the abstract and sometimes the entire article discussing the fact that I'm citing. Most of this information initially came from the research and brilliant mind of my colleague, Mr. Bill Sardi, who unfortunately passed away several months back, but most of this information is due to his diligent research. Even today, it's pretty much assumed by people that are aware, scientists that are aware that regular animals make vitamin C in their liver, that human beings cannot make it because they have a defect in the actual sequence of the nucleotides in the DNA. In most of the wild animals, they not only make vitamin C on a regular basis around the clock, along with cortisol released from the liver, they make a lot of vitamin C and release that into the blood in the face of acute infection and acute oxidative stress. I'm going to show you some of the evidence in the scientific literature that indicates the inability of human beings to make vitamin C is not because the sequence of nucleotides in the DNA is missing or in error, but the interpretation, the transcription of those DNA nucleotides is what's the problem. Because I'll talk about this a little bit more, but you have genetic defects and you have epigenetic defects. Genetic defects means you no longer have the proper sequence of nucleotides coding for a protein in the DNA. And epigenetic means you've somehow lost the ability to transcribe correctly and accurately the RNA that comes from that DNA to make a protein. And as we'll see as we go on, these epigenetic defects, this acquired inability to properly produce a protein from a correct DNA strip, is actually much more common than we think and is almost always acquired after birth. Like we've talked about in other presentations, all damage in the body is caused by oxidation, and all good things in the body are pretty much caused by repair of that oxidation. And so it appears that agents that can target these sequences that need to be properly read to make a protein end up being oxidized, and we have found agents that are able to repair this. To be specific, the protein that's directly involved in converting glucose into vitamin C is called L-gulonolactone oxidase, abbreviated as GULO, G-U-L-O. And this is the final enzyme in a sequence of 4 enzymes that are needed to make this conversion. All human beings, the first 3 enzymes are in good shape. It's just this 4th enzyme that we have problems with. Now, when I talk about a DNA sequence being read, producing messenger RNA, and then that messenger RNA has a ribosome that rides along it, producing the different amino acids that make the final protein. It might be a little amusing, but you're literally having a ribosome ride along the messenger RNA like a train on a track, producing the protein, and the train encounters a big lump in the track or like a piece of gum on a zipper and stops. When you can get it to jump over that gum and complete the transcription, you can still make the protein, which is what we'll be talking about. When you're able to bypass or go over this piece of gum on the zipper, this is referred to in the literature as stop codon read-through. Now, we know of some other inherited diseases that pretty much medicine thinks are fixed problems with DNA, are also epigenetic problems with abnormally placed stop codons. And this includes beta thalassemia and cystic fibrosis. These studies also show that there are drugs, in this case, aminoglycosides, that can jump over the piece of gum and restore protein synthesis in the RNA strands and help lessen and sometimes eliminate much of the problems of these inherited diseases. It's very important to find agents that have little or no toxicity at all to stop this epigenetic defect, because drugs like aminoglycosides have significant toxicity, and you don't want to take those for extended periods of time or even for life. In fact, now, and you see these references that you can go to, there are quite a number of natural and non-toxic molecules that have been discovered which appear to allow jumping over the phenomenon known as stop codon read-through. I'll read this directly because it's very important, and that is the concept of acquired epigenetic defects is further supported by infants who are not born with thalassemia, but later develop thalassemia along with the inability to synthesize enough hemoglobin to survive without need for repeated blood transfusions. In the test tube, resveratrol, a polyphenol in grapes and wine, has actually been found to induce the production of fetal hemoglobin in patients with thalassemia. Of course, even though it's not 100%, it was shown that fully 50% of these thalassemia patients completely no longer needed repeat transfusion after resveratrol treatment, indicating the epigenetic defect had been overcome. Guinea pigs are sort of the animal equivalent of human beings, and they can't make vitamin C as well, but they do have the proper genetic code to make it. They just also don't have the ability to transcribe it into the protein. However, if you look at these references that I have here, there is a small minority, but nevertheless, animals and people exist among these guinea pigs and people that do actually synthesize vitamin C in their livers. It would appear that babies regularly make vitamin C, which would mean it's not a fixed genetic defect, but an epigenetic defect. In the womb, the baby makes large amounts of vitamin C and ends up with brain levels of vitamin C 400 to 1,000% higher than most adults. Similarly, umbilical blood appears to have most of the time fourfold, 400% more vitamin C than the maternal blood. Information on babies indicates that breastfed babies, even though all their nutrition is coming from mama, they maintain blood levels 200% higher of vitamin C than of the mother, and it was not reflective of the vitamin C levels in the breast milk. Very difficult to imagine how these levels of vitamin C inside the fetus and inside the babies after they're born could be coming from anything other than new synthesis of vitamin C in those very young livers. Children, well beyond infancy, in this particular tribe, Bantu tribe children in South Africa, even though they were taking in an incredibly tiny amount of vitamin C daily, 3 to 8 milligrams per day, the symptoms of scurvy never appeared and were never noted. In writing the paper, the investigators themselves concluded that the only logical conclusion is to postulate that there is an endogenous or internal production of vitamin C in these children. Let me say, and this is my opinion, I think these Bantu tribe children were effective at making vitamin C because they lived far away from the enormous amount of toxins that we see with children in much more modern civilizations in both food, air, and water. And yes, some adults make vitamin C. They have, in the past, done studies on adults by seeing how long it takes for them to stop spilling vitamin C in the urine and to start developing symptoms of scurvy and vitamin C depletion. One study, an adult female, actually continued to show high blood levels even as the vitamin C intake got progressively lower and lower. Another woman went 149 days, almost half a year, without any dietary vitamin C, and she developed no deficiency symptoms at all of vitamin C. Similar findings to these isolated adults have been seen also in isolated guinea pigs, some of which appear to make normal levels of vitamin C. To re-emphasize this primary point of genetics versus epigenetics, epigenetics refers to the variable genetic expression due to modifiable factors that can block or impair the accurate transcription of messenger RNA coming from the DNA. And to boil it down to 4 words, and it's always good to be short and concise, epigenetics means correct code, incorrect translation. So reflecting on all the studies that we've seen on fetus, babies, children, and adults, it appears certainly that nearly everybody initially has the ability to make vitamin C at a very young age and eventually loses it, presumably due to their unique but unavoidable exposure to the wide range of toxins that we're exposed to on a daily basis around the world. Now, in a pretty incredible study done in 2017, the polyphenol hydroxytyrosol, which comes from olive leaf extract, was found to double the average levels of vitamin C in healthy volunteer subjects. This doubling of concentration persisted because 45 milligrams a day of this polyphenol showed that at 1 month, the levels were doubled, and at 2 months, another test was run and they were still doubled. As a result, and it shouldn't come as a surprise, the body-wide effects of hydroxytyrosol administration appear to closely parallel the effects of vitamin C administration. Now, at the Reardon Clinic, Dr. Ron Honeyhackey ran some additional tests on oral hydroxytyrosol. 5 volunteers, they were given 50 milligrams of hydroxytyrosol a day. And after only a week, depending on the person, the blood level of vitamin C was up between 50% and 200%. Not surprising, the lowest levels of vitamin C showed the most profound response in one smoker who had quite a depressed vitamin C level at the start, got a dramatic increase in the vitamin C level on the hydroxytyrosol. In 4 of 5 volunteers, a clear-cut elevation of blood vitamin C was seen the day after the first dose. This is important because even though my recommendation to anybody who wants my recommendations is that you should be on hydroxytyrosol, basically a quality olive leaf extract product for life, if you don't have the inclination to do that, or it's too expensive for you, you should still have a bottle around because it appears that you can cause a quick response of vitamin C synthesis very quickly, and this can help you get over acute infectious syndromes. It also appears that the vitamin C blood levels stayed elevated in this particular case for a full 10 days after the 2-week administration of the hydroxytyrosol. Though we don't have the studies to show it, I seriously doubt that taking hydroxytyrosol and then stopping it is going to give you a lifelong result of increased vitamin C synthesis, because whatever caused the epigenetic defect, whatever toxins that you faced are going to continue. So it's my impression, without further studies, that the hydroxytyrosol in the form of olive leaf extract should be taken for life for this incredible benefit of starting vitamin C synthesis again. 2 people, namely Dr. Honeyhackey and myself, who had been taking hydroxytyrosol for some time, we decided to see whether a large dose of toxin, which is going to use up vitamin C and depress the levels, what that would do inside us, assuming that our livers were able to respond to that toxin and start making more vitamin C rather than less. We were all set up to get vitamin C blood levels drawn. After a large amount of alcohol was ingested, blood levels were taken, and they initially showed a severe depression, which meant the alcohol was metabolizing the vitamin C, but it was rapidly followed by a large rise in vitamin C that stayed high for nearly 18 hours after the alcohol ingestion. Remember that vitamin C is not stored in the body. And if your liver cannot make vitamin C, then when you're exposed to a toxin, all it does is drop the vitamin C until you take more vitamin C orally. I'll show you on the graph on the next slide that the vitamin C level rise was quite significant, and it persisted for 18 hours. And the next morning, both Dr. Honeyhackey and I felt not just good, but we felt particularly good, which would be consistent with having even more vitamin C in our body than normal. These two, and on this slide, alcohol is in blue, alcohol blood level is in blue, vitamin C blood level is in red. Just like we noted, the immediate effect in both Dr. Honeyhackey and myself was a quick and massive drop of vitamin C as the alcohol reached peak levels. Just the opposite occurred with a little more time as the liver realized, if you will, that the toxin was present and then started making more vitamin C, which caused the red line to go up while the blue line went down. Now, the short and long-term health benefits of this cannot be overemphasized. There is no medical condition or disease, no matter how well it's being treated, that will not be even better treated when the liver is making vitamin C on demand with increased amounts when there's more oxidation and more infection present in the body. Many different animals can make their vitamin C. A goat, about the size of an average human being, can make 13 grams, 13,000 milligrams of vitamin C a day. If your liver is making 13,000 milligrams of vitamin C per day and releasing it directly into your bloodstream, this is not remotely approached by taking 13,000 milligrams of vitamin C orally because of absorption problems and many other problems. You would have to take a much, much, much larger dose of vitamin C orally to even come close to what you can achieve when it's being directly released into the blood. I want to address the incredible synergism between the two most powerful and naturally occurring anti-inflammatory agents in your body, vitamin C and cortisol. If your liver is working correctly, like it is in the wild animals or in a human who has overcome the epigenetic defect, two things happen when you have a large amount of infection or oxidative stress in the blood. Presence of large amounts of oxidative stress in the blood causes the simultaneous release of large amounts of cortisol from the adrenal glands, while the liver is releasing large amounts of vitamin C into the blood. The liver is making vitamin C from glucose. So this is allowing your body to use up glucose stores properly rather than let them stay elevated and cause long-term diabetic and other sugar storage problems. This is especially important, and I don't have time to go into it in detail, but it would appear that a primary role of cortisol, maybe the primary role of cortisol, is to force the uptake of vitamin C into the cells of the body. This means that anything that can cause the human liver to start making its own vitamin C results in a significant increase in intracellular vitamin C levels throughout the body because the cortisol is being released from the adrenal glands at the same time. So to give it a little bit of a sequence here, this is what should happen when your liver is making vitamin C. New blood toxins result in both vitamin C and cortisol release, which immediately causes a massive increase in the cellular uptake of vitamin C throughout the body. Interestingly enough, the cortisol also provokes new glucose production, which allows it to further feed and sustain the ability of the liver to make more vitamin C. Just like it worked in Dr. Honeyhackey and myself, this increase in vitamin C synthesis and it's being pushed into the cell by the cortisol continues until the oxidative insult has been completely neutralized. In our case, the vitamin C level stayed up for 18 hours and even had us feeling better than normal before it came back down again. Very important points here. And I have a lot of information on this, but it's beyond the time that we have here. Infections of all variety occur because cellular levels of vitamin C have dropped too low. Patients that have little or no adrenal function, meaning they can't make cortisol, the primary concern is life-threatening infection because there's nothing available to push the vitamin C into the cells. It's well established that old patients develop sex hormone deficiencies, they develop thyroid hormone deficiencies, and guess what? Most of them develop a mild to moderate to severe degree of cortisol deficiency as well. It's not normal to get a cold or the flu, or even COVID for that matter, and keep it for more than 24 hours if you're making enough cortisol and if you're making enough vitamin C. If you keep a cold or flu or COVID for days to weeks, you are cortisol and vitamin C deficient. And here are two articles I've written on this that go into a lot more detail on this interaction and synergy between vitamin C and cortisol. With regard to hydroxytyrosol, you generally want to get yourself in a dose level of 45 to 50 milligrams daily. The best known source of hydroxytyrosol is olive leaf, and to a much lesser extent, olive oil. Hydroxytyrosol, in addition to the effect it appears to have on allowing the synthesis of vitamin C in the liver, it's also by itself also an extremely powerful antioxidant. Olive leaf, and I plan on doing much more research on this, also has an incredibly large number of highly beneficial substances in it, including two substances known as oleuropein and tyrosol. At this point in time, my advice is to take an olive leaf extract supplement that can give you 45 to 50 milligrams of hydroxytyrosol a day or more, but to take the whole extract. It's incredible, and there's a very large amount of literature talking about the benefits of olive leaf extract for just about every condition under the sun. Some sensitive stomachs require that it be taken with a meal, but most people are not that sensitive. I've long talked about what I consider the four most important supplements, which are magnesium, vitamin D2, vitamin C, and vitamin K2. Would wholeheartedly add to that list olive leaf extract as being something you should never go without taking if you have availability and if it's not too expensive for you, because its health benefits, in addition to what it does to vitamin C synthesis, are truly extraordinary. And that's it.
Thank you for this.
Thank you very much, Professor. For me, it's an amazing conference. We have chance to be here today to listen to this, how I can say, a new way in good health by using olive leaf and.
I'll be back in 1 minute.
C'est OK.
Alors, vous savez qu'il y a there is the female olive tree and a male olive tree. What are they the same?
Ok.
We don't
Professeur
hear you,
Levy,
Dr.
son micro n'est pas activé.
The microphone, please.
He needs to activate his microphone. Oh. Professor Levy?
Okay, sorry.
Okay.
I'm just really getting
Okay,
into my
sir.
olive leaf research now. And
I am
that's
here.
very interesting. I had no idea there was male and female trees. That's I would hazard a guess from the literature that I've read already is I've never seen an article on olive leaf harvesting that differentiated an important difference between a male versus a female tree. So I would think it's not important, but I can't say so for sure.
Thank you.
Madame Bussarini posait la question par rapport à est-ce qu'il y avait une différence entre l'arbre de pied femelle ou mâle? Est-ce qu'il y avait une différence? Alors, selon professeur Levy et selon tout ce qu'il a vu dans la littérature scientifique, il n'a pas vu un article qui décrit une différence importante entre les deux. Alors, il n'est pas 100% sûr, mais il dit qu'il n'y a pas vraiment une grande différence entre l'arbre d'olivier femelle ou mâle.
On va essayer de prendre quelques questions du chat en attendant de voir des mains levées.
Now, we're not talking about olive trees that identify as male or female, right? That's a little joke.
Yeah.
I got a question.
Question?
Is there a difference in the developmental stage for preparation of the extract from the leaves? Because you know how microgreens, they have the great nutrient density with harvesting the olive leaves.
Well, again, I'm just beginning my research into this, but one of the things that does jump out is the maturation of the tree and the fruit and the leaves does make a big difference in content. So those are factors. I can't tell you which one factors in how, but yes, that's an important factor.
I know a olive tree farmer right here in Central Florida. So I figure maybe I'll just talk to him. Just let me know if you have interest.
Okay.
Thomas, I have used the olive leaf extract from barleys, and it's excellent. At the onset of a cold in people is amazing how it will convert vitamin C in the body.
I don't know if you caught what I said at the end is I put it down on my top 5 supplements and everybody should take it. Magnesium, vitamin C, vitamin D, vitamin K, and olive leaf, and then whatever else you want is fine. But those should be in it for everybody. I'm just blown away by what quality olive leaf extract does for every part of your body and every medical condition imaginable, above and beyond what it appears to do to vitamin C synthesis.
Excellent. Well, I'll let you, I'm going to go again, but thank you for the lecture. Take care, guys.
Thank you. Can you translate?
Alors, pour la première question, on demandait s'il y avait une différence dans la préparation de cet extrait de feuilles d'olivier. Alors, professeur Levy, il a dit bien sûr qu'il y a des facteurs qui peuvent impacter ça, notamment la maturation de l'arbre, la qualité du fruit, de la feuille. Ils ont un impact sur l'extrait qu'on a à la fin. Et pour la deuxième, on a, je ne sais pas, le deuxième intervenant, c'était qui exactement, mais il a dit qu'il prenait régulièrement ses feuilles d'olivier s'il a un rhume et qu'ils étaient excellentes pour le rhume. Et bien sûr, professeur Levy a dit que c'est pour ça il a ajouté l'extrait de feuilles d'olivier à la liste des suppléments élémentaires comme la vitamine K, D, magnésium, parce que ces bienfaits dépassent l'activation de la synthèse de vitamine C. L'extrait de feuilles d'olivier, il a des bienfaits énormes sur plusieurs maladies.
Merci, Esma. Pour enchaîner, je vais lire la question de Ramazi. Est-ce qu'on peut prendre les feuilles d'olivier fraîches? Si oui, comment? Et la quantité pour avoir les 50 grammes d'hydroxytyrosol?
There is a question, Professor Levy, about if we can... Milligram, right. Professor Levy, someone was asking about taking fresh olive leaves. Can we take fresh olive leaves? And if so, how can we get this 50 milligrams that we should take daily from fresh olive leaves, not the supplement that we find on the stores?
Well, if you go online or go to different places where you can order olive leaf, you'll see there's a wide variety amongst preparations, potencies, and all of that. So you need to read your labels and try to get something that's as quality as possible, that has a high content of hydroxytyrosol. And I saw another question, amazingly enough, is in French, but I think I understood it. They're asking about olive leaf extract in cancer. And this is just a very general guideline. Do not consider this to be some sort of set protocol, but for something like that, it's good to be taken something on the order of 3 grams of olive leaf extract a day, like 2 500 milligram capsules 3 times a day. That would be a good dose. But that doesn't mean you can't take less. That doesn't mean you can't take more. Ironically enough, and pleasantly enough, right along with vitamin C, ironically enough, no known toxicity level of oral olive leaf extract has been established.
Mm-hmm. Yeah, Professor Levy, the question was about taking the concrete, not the supplement, but the concrete leaves.
I was looking at this.
There was a question about what about... Yeah,
I don't know.
Yeah.
I don't know how
similar,
you would. I don't know how you would approach the unprocessed leaves. That's beyond me. I don't know.
Okay. Alors, pour la question concernant les feuilles d'olivier, comment peut-on prendre les feuilles d'olivier et extraire 50 mg? Professeur Levy dit qu'il n'a pas d'informations par rapport à comment procéder avec des feuilles d'olivier fraîches. Mais il donne ses recommandations par rapport à comment choisir un supplément d'extrait de feuilles d'olivier. Il doit être de bonne qualité parce qu'il y a une grande variété dans le marché et il doit bien sûr contenir un dosage élevé d'hydroxytyrosol. Et dans le chat, il a vu une question par rapport à l'utilisation de l'hydroxytyrosol dans le cas d'un cancer. Alors, il dit qu'il conseillerait de prendre 3 grammes par jour ou 2500 mg 3 fois par jour. Et bien sûr, il n'y a pas de dose, une dose énorme ou moindre parce que l'extrait de feuilles d'olivier, il n'a pas de toxicité. On peut en prendre la quantité qu'on veut sans atteindre aucune toxicité.
Let me also say, Asma, there's a little book out there published in 1997 entitled Olive Leaf Extract, written by Morton Walker. And
olive leaf extract. Okay.
Olive leaf extract written by Morton Walker. And it's a treasure trove of data. And also in reference to what the person just asked about, I do believe it talks about taking olive leaves directly and making teas out of them. So there are a lot of different ways. You can have olive leaf extract as a cream for dermatological reasons. There are many different ways to apply this. They even talk about, in this particular case, he didn't say nebulization, but he talked about nasal irrigations for dealing with viral syndromes, and very likely, I would think, for the same reasons, COVID. So I believe I do not yet have this track record, and I have not yet used it, although I've ordered it. I plan on trying some olive leaf extract liquid in drops to add to nebulization. But that's just what I plan to do for myself. I'm in no position to recommend it one way or another now. I'm just saying it presents a very interesting possibility.
Professeur Levy recommande pour les gens qui posaient la question par rapport à l'utilisation de ces feuilles d'olivier fraîches, il dit qu'il y a un livre qui parle de comment utiliser ces feuilles d'olivier à plusieurs formes. Il s'appelle, c'est un livre en anglais qui a été publié en 1997. Il s'appelle Olive Leaf Extract de Martin Walker. Et dans ce livre-là, il parle de comment prendre ces feuilles d'olivier sous forme de tisane, comment les utiliser sous forme de crème pour des raisons dermatologiques. Il parle aussi de comment utiliser l'extrait de feuilles d'olive sous forme de liquide et l'utiliser sous forme pour l'inhaler. Professeur Levy, il a commandé ce liquide de feuilles d'olivier et il planifie de l'utiliser dans son processus de nébulisation. Ça, c'est juste son expérience personnelle. Il ne recommande pas ça au public, mais il planifie d'expérimenter les feuilles d'olivier liquides dans le processus de nébulisation.
Très bien, merci.
Another question.
Une question de Hanifa.
Oui, bonjour. Voilà, moi j'ai deux questions. Alors la première, c'est l'action de l'extrait de feuilles d'olivier dans les métastases hépatiques. Et puis la deuxième, bon, c'est une question plutôt personnelle. Je vais essayer de la poser en anglais à monsieur le professeur Levy. Voilà. Alors, excuse me, Professor, I don't speak English very well, but it's very important for me to have your opinion about a family disease that has no treatment. It's an orphan disease which is named Rendu-Osler disease. It consists of capillary fragility without coagulation disorder. This disease manifests itself through important epistaxis, which leads to chronic anemia, collapse of ferritin, hepatic and cardiac complication. I want to know if vitamin C or other vitamins have their place in this treatment, in the treatment of this disease. Thank you. Voilà, c'est ça.
Any bleeding disorder, epistaxis, bruising, is nearly always a result of a severe vitamin C deficiency. Anybody with any disease, genetic or otherwise, needs all of the vitamins and minerals we talk about even more than somebody that doesn't have it. So I don't think there's a contraindication for anybody to take good supplements and good nutrients. And having said that, I'm not familiar with treating this disease in particular, but I would certainly see not only what vitamin C does for this individual, but also vitamin C as a trial and to see how it works. vitamin C combined with cortisol, as I discussed in the articles that I cited in my lecture, though I would refer you to go to those and get more information. But when you can take vitamin C and cortisol together, you can get some incredible benefits that you don't see with either one by itself.
Alors, je vais traduire premièrement la deuxième question de Dr. Hanif Ibrahimi par rapport à la maladie qu'elle a décrite. Alors, professeur Levy dit que tous ces problèmes qui sont liés, problèmes de santé qui sont liés aux problèmes de coagulation, ils sont
En fait,
bien sûr causés.
Problème de coagulation. Il n'y a pas de problème de coagulation dans cette maladie. Il y a un problème de fragilité capillaire. La coagulation se fait, mais elle se fait lentement, c'est-à-dire elle existe, mais la fragilité capillaire donne des saignements qui sont très, très difficiles à résorber, très, très difficiles. Mais il y a la coagulation, le facteur de coagulation existe. C'est surtout la fragilité et il n'y a pas de traitement, c'est ça.
Ouais, exactement, voilà. Quand il y a des problèmes de saignement, il a dit que c'est dû en général à une carence énorme en vitamine C. Alors, il suggère que vous pouvez essayer l'introduction de la vitamine C en combinaison avec le cortisol. Et voir que, oui, parce qu'en général, ça a des résultats bénéfiques et voir ce qui en résulte. Parce que, comme il dit, il n'y a pas de contre-indication pour prendre tout type de vitamines et une alimentation bénéfique. Alors, il dit que vitamine C et le cortisol peut avoir un résultat bénéfique dans ce cas-là, mais aussi, on peut aussi prendre tous les vitamines et les suppléments dont le corps a besoin.
Est-ce que je peux avoir la quantité, s'il vous plaît?
De tous ces vitamines-là?
Cortisol, par jour.
Cortisol, ok. Je vais lui poser
vitamine
la question.
C aussi.
Parce qu'en général, vitamine C, c'est par des doses personnalisées. Mais je vais demander.
Oui, je sais, mais lui... Parce que là, déjà, il y a une prise quotidienne de 4 grammes, mais bon, ce n'est pas suffisant, certainement.
D'accord. D'accord. Professor Levy, Dr. Brahimi was asking about the dosage of vitamin C and cortisol in this case. She was saying that the daily intake of vitamin C so far is 4 grams. She believes that this is really low, but she was asking about the specific dosages for cortisol and vitamin C in this case.
I can't give specific dosages. This involves clinical adjustment to see how one dose works, the effect that it has. So there's not a set dosage. But what we're talking about is replacement dosages for the adrenals not working sufficiently. We're not talking about steroid therapy like prednisone and methylprednisolone and all the problems that you get in. We're talking about just like when you're estrogen or testosterone deficient or thyroid deficient, you take enough to correct the deficiency. So here you take enough, which is a clinical decision, to get an optimal effect by adding the cortisol to the vitamin C. And this again is discussed in much more detail in the articles that I linked to in the presentation.
Dr. Brahimi, professeur Levy dit qu'il n'y a pas un dosage spécifique. Ça reste, c'est une décision clinique. Il faut donner des doses et attendre de voir le résultat. Il n'y a pas une dose spécifique. Ça reste toujours une décision clinique, mais il faut donner la dose suffisante pour sortir de cet état de déficience. Et il dit aussi qu'il y a plus d'informations dans les articles qu'il a mentionnés dans sa présentation.
Ok, merci beaucoup. Merci bien.
Je vous en prie. Il vous reste la première question.
Oui, voilà, le hépatique.
Voilà. Professor Levy, Dr. Brahimi was asking also about how the extract of olive leaves can be effective in dealing with hepatic metastasis.
Voilà.
Well, there's a large amount of literature. I would say you go to PubMed, type in olive leaf cancer, and you'll see that there's an enormous amount of research on this, both in vitro in vivo with animals and in clinical studies with humans. And the olive leaf extract, virtually in all of the studies, is profoundly positive in improving, slowing down, and sometimes reversing cancer. So I can't tell you that specific cancer, but I can tell you that as a general agent, it's very powerful as a adjunctive anti-cancer agent, certainly.
Alors, pour le cas des cancers, professeur Levy dit que sur le lien de PubMed, il y a plusieurs recherches scientifiques qui ont été publiées et qui décrivent plus amplement les résultats bénéfiques qu'on peut avoir dans les cas de cancer. Il suffit juste d'écrire Olive Leaf Cancer dans le moteur de recherche de PubMed. Et en général, il dit que l'extrait de feuilles d'olivier a des résultats spectaculaires sur l'amélioration d'état des maladies cancéreuses et même dans des cas, il peut même renverser certains cancers. En général, l'extrait de feuilles d'olivier est très puissant dans ces cas-là de cancer.
OK, merci beaucoup. Thank you very much. Merci.
Je vous en prie.
Je vais prendre quelques questions du chat en attendant que quelqu'un lève la main. Les questions sur
c'est à propos de l'infusion. Est-ce qu'elle est efficace ou pas?
bon, oui. Il y en avait 2 ou 3 questions sur l'infusion, les tisanes, les proportions d'hydroxycortisol. Est-ce qu'on prend les feuilles fraîches ou bien en tisane, ou bien est-ce qu'il est préférable de les prendre en gélule? Voilà.
Professor Levy, there was a question about olive leaves. Are they really beneficial in form of infusions, or is it preferable to take them as a supplement, which is more effective, the infusions through olive leaves or the supplements? And they were also asking about the required quantity of those olive leaves.
I don't know for a fact whether there's any olive leaf preparation that can be given intravenously. I just don't know. Perhaps there are some papers out there that discuss this. I'm not aware of them, but certainly there can be different infusions of some of the different compounds inside olive leaf, probably hydroxytyrosol, but I've not seen that given intravenously as well. Again, not to say that it can't be done. I'm just not aware of it. So but what was the second part of the question?
Now, they were asking about which is better. You gave us a really good point, but they were asking about the taking olive leaves in forms of tisane. Which is better, the form of tisane or taking them as supplements?
Tisane, supplements or what?
Infusions.
Infusions. Okay.
Infusions.
Again, like I said, I don't know if it's being given as an infusion or not. So everything I'm talking about is with oral olive leaf extract.
Okay. Professeur Levy, alors par rapport à la question qui demandait si quel est le format le plus bénéfique, est-ce que les feuilles d'olivier en forme d'infusion ou les feuilles d'olivier en forme de supplément? Alors pour professeur Levy, il a plus d'informations par rapport au supplément, mais cela n'empêche pas que les autres formats d'ingestion ou d'administration des feuilles d'olivier, soit par voie intraveineuse ou tout autre format, a aussi un impact bénéfique. Mais il n'a pas des informations spécifiques par rapport aux autres formats. Sa présentation et sa recherche étaient plutôt concernées par rapport à la forme d'hydroxytyrosol sous forme de supplément.
D'accord. Voilà. Les amis, si j'ai oublié une question à poser, levez la main.
Et il faut juste préciser qu'en parlant d'infusion, c'est pas la voie intraveineuse. It's like tea when you use hot water with olive leaves. There is same good effect or not?
As far as I know, the teas made from olive leaf are very good. I suspect it's a matter of dosage, you know, just like when you nebulize something, you're taking in a much smaller amount. I don't know that one would be better than the other. I suspect the oral would be better because I think you'd be taking a larger amount of the substances, but I don't know.
Et par rapport à prendre les feuilles d'olivier en forme de thé, professeur Levy, il dit c'est bien, ça pourrait avoir des résultats bénéfiques, mais il n'a pas d'informations par rapport au dosage. Pour lui, prendre l'extrait de feuilles d'olivier par voie orale, il est bénéfique parce qu'on peut prendre de grandes quantités.
Let me say this too, Asma. I saw a little question that's asked about what kind of cortisol. Cortisol given as a prescription is hydrocortisol, okay? And that's all we're talking about. We're not talking about prednisone or dexamethasone or methylprednisolone or any of the other synthetic, prescribed, super powerful, way beyond physiological need type steroids. We're talking about cortisol only, which in prescription form is hydrocortisol.
Okay. Professeur Levy, quand il parle de cortisol, il dit que c'est l'hydrocortisol. Il ne parle pas des types de cortisol synthétique qui dépassent les capacités physiologiques du corps humain. Il parle notamment du cortisol l'hydrocortisol.
Naturel, pas les médicaments.
Naturel, oui.
Question de Nadia?
Yeah, I would like to know if there has been any studies done if we take into account the mental health, like for depressed people, because we know people in inner peace, they normally get less sick, and were there any studies, you know, in that?
I'm in the process of reviewing this, but I don't think there's any medical condition that olive leaf extract does not improve. Now, to the degree that it does it, that's another question, but just like being able to synthesize more vitamin C, if it can do that, it's going to make everything better regardless. And in the neurological system, your neurons, when they're healthy, contain the highest concentrations of vitamin C anywhere in your body, 100-fold more than the surrounding extracellular fluid and plasma. So no, it's critical for any sort of mental or psychiatric disorder, and I would be surprised. Like I said, there are many studies I haven't looked at yet, but I think they've all been done.
Okay, thank you.
Sure. Asma?
Merci Nadia.
Too much. Oops.
Asma? Asma, are you here? She's gone.
Uh-oh. She got tired.
She got disconnected.
Yeah, maybe so.
Donc, la forme en infusion n'est pas évaluable. Donc, il vaut mieux se référer à la forme en capsule de feuilles d'olivier. Et pour ce qui est des différents types de cortisone, bon, bien sûr, il faut que la prise soit adaptée et courte, donc de moins d'une semaine. Et il y a plusieurs formes de cortisol, donc ça varie d'une indication à une autre. Mais il faut savoir maintenant, ce qu'on vient d'apprendre aujourd'hui, c'est que on a la vitamine C, mais on a également l'hydroxytyrosol. Et donc, à partir des feuilles d'olivier, on peut synthétiser nous-mêmes notre propre vitamine C. D'ailleurs, c'est ce que je fais depuis quand, Maha?
Puis décembre.
C'était en novembre, décembre, c'est ça? Oui.
Décembre,
Et donc, voilà. Et donc, je ne consomme pas de vitamine C. Je consomme des feuilles d'olivier en capsule. Ça existe en pharmacie en Algérie. Et je produis ma propre vitamine C. Et vous avez dû le remarquer de vous-même, voilà, quotidiennement. So, Professor Thomas, I say that I took from the December olive leaves and I have good results with it in capsules. And I think it's an amazing thing. For that, your conference is like a new way for the original medicine to take what the body needs and to keep the body making the best for us.
Absolutely, Ilyas, absolutely.
Yes. And for that, this conference, I think, it is the century conference. La conférence du siècle. Et ceux qui sont présents sont des élus de Dieu. Voilà. Who are present are had a great chance to be here today to know about this because I say Dr. Hugh Riordan, as you know, and it's never like before.
Absolutely.
Absolutely.
So thank you very much.
Can I
amazing. Yes, Maha.
Can I add a last question from
Yes.
Asma Yendel?
Yes.
About the combination. Asma, are you here to translate?
Yes, I'm sorry, I don't know what happened.
Voilà, voilà, elle est là. She's back. Est-ce
She
qu'on
was
peut
having
prendre
an
le
asthmatic
feu
attack.
d'olivier?
Yes.
From asthma to asthma. Yes.
Yeah. He needs an antioxidant agent. He needs vitamins and cortisol. Oh yes, olive oil extract.
Est-ce qu'on peut prendre les feuilles d'olivier et en même temps la vitamine C?
Yes.
Miss Yendel was asking about, can we take the same time both the extract of olive leaves and vitamin C?
Of course. I tried to make a big point that taking the two simultaneously at the same time, you get an enormously improved uptake of the vitamin C inside the cells. So yes, absolutely.
Professeur Levy dit bien sûr, on peut les prendre tous les deux. Bien sûr, ça va avoir un impact hyper positif et une amélioration énorme dans les taux de vitamine C intracellulaire.
Très bien. Voilà. No more questions.
Okay. All right.
Yes, we can.
Thank you, everybody.
Thank you very much.
Thank you.
Thank you, and thank you to all of you, and see you next. And thank you very much for this amazing conference. Thanks you to Dr. Maha Shaikh for making this Zoom conference possible. Yes, thank you for Asma Misbahi for translating, and thank you to all,
incredible translation, Asma. Incredible translation. I'm impressed.
It's always an honor. It's always an honor, Professor Levy. I'm sorry for the interruption. I don't know what happened with my connection. I'm really sorry.
Okay. All right.
And we are a VIP guest today, Bo Johnson, Victor Martial, and Todd Perberti. So thank you for all the guests and all participate from VIP group. So thank you and see you for the next conference. And you are welcome in Zoom conference every time. So thank you very much.
Okay. Bye-bye all. Thank you.